Good evening, Port St. Lucie. It's your Mayor, Greg Oravec, and this evening we're once again joined by our City Manager and Incident Commander, Russ Blackburn, and tonight's special guest is Pete Tesch. He is the President of the Economic Development Council of St. Lucie County, youredc.com. And as we've discussed in the past, as mayor in our form of government, I am the ceremonial head and the chairman of the board, the chief legislator, but our chief executive under all circumstances, and our incident commander, our leader, our commander-in-chief in the time of an emergency is Russ Blackburn. So with no further ado, Mr. Blackburn, good evening, sir.
Yes, thank you, Mayor. I appreciate it, and we're pleased to have people listening to us and hopefully get information from the city. Thank you, Mr. Mayor. I appreciate it. We're very pleased tonight to also have joining us Pete Tesch, the President of the Economic Development Council. Last week, we had an update on Facebook Live that was immediately following the governor issuing a Better Off at Home order, and we provided some general information on that Better Off at Home order. We're running in, I believe, now starting our 4th week of an emergency. Port St. Lucie has declared a local state of emergency that joins St. Lucie County with a local state of emergency for the county, and then certainly the state of Florida as a declared state of emergency. So we believe we're beginning to understand the Better Off at Home order. Certainly as a city, we really are continuing to offer our essential services and have, I believe, got a good sense of how we keep those services running for our citizens. So we had some questions last week, which I think still are important. We had a question, is the city under a curfew? And the answer is no, we aren't under a curfew. But absolutely, if you look at the governor's executive order, it orders individuals to stay at home. It's the whole idea that you're better off at home, but that you can leave your home if you are working or in a essential function, or if the essential function is providing a good or service to the community. We have information on those essential functions on the city's website, on the governor's executive orders, a section on the internet that you can find those Governor DeSantis executive orders, and on the Florida Division of Emergency Management. So city continues to provide services. All of our business functions are open. The main thing that we are not doing under this local state of emergency is having face-to-face services. But all of our services are available. You can call us, you can send an email, and we are working to do everything we can to make sure that our city continues to provide the services our community needs.
Thank you, sir. And in this moment of crisis, it can kind of be hard to keep up with all the dates. A lot of people are talking about that their sense of time has been thrown off. You declared an emergency, I believe, on March 17th or thereabouts?
Yes, Mr. Mayor.
And I believe that St. Lucie County confirmed that the first person in St. Lucie County had contracted COVID-19 on March 21st. And so here we are just 18 days after, and I believe that the last statistics that were available is that we have 130 people in St. Lucie County who have been confirmed to be infected. And very sadly, we've lost 6 of St. Lucie County's residents to COVID-19, and we send them our deepest sympathies. The family and friends, those mourning the lost, we send them our deepest sympathies. As of this moment, the last information available, I believe that Florida had 15,698 cases of COVID-19, and I'll have to check to see how many have sadly passed away. But in our fight against COVID-19, against the invisible enemy, there's been just an incredible effort by all residents of Port St. Lucie County, that we are safer at home, that we are practicing social distancing, that we're doing all the things that we can do to get through this response faster, so that we can get to the other side and start the recovery. So citizens have been asked to do a lot. We've been asked to limit our freedoms and just go wherever we want to go. And very sadly, it's impacted the economy and our businesses. And this has been well chronicled, the number of jobless claims out there. There's a historic level. People are hurting. People are without work. And the state is doing its very best to ramp up the DEO's, the Department of Economic Opportunities, efforts to accept reemployment assistance applications, and all levels of government and countywide organizations are working to kind of break down the silos and just figure out how to help people. So a lot of this pain is being felt by our businesses and our business communities. So in addition to the employees that are out of work, been furloughed, laid off, we also have businesses that have shut their doors. They're in danger of closing, not just now, but forever. We don't want that to happen. There are roughly 3,800 businesses in the city of Port St. Lucie, and we're very lucky to have caring community organizations, of course, like the Chamber of Commerce, and then also our Economic Development Council. And Mr. Tesch, thank you for coming out and being with us and our community this evening. And we look forward to hearing from you and you sharing whatever you'd like to with the citizens of Port St. Lucie.
Thank you, Mr. Mayor, Mr. Blackburn. Excuse me, it's a real pleasure to be here. And on behalf of the Economic Development Council, we feel the same way you do. You know, our condolences to the people and the families in St. Lucie County. Also to those that have experienced layoff and furloughs. I know it's a very difficult and stressful time in our community. Just a little background, the EDC is a nonprofit organization. We're made up of a board of directors and a staff of 6, so we're a small organization, but powerful. Our mission is to help create jobs for the community. Obviously, the COVID-19 crisis has put everybody in a different situation, and our leaders with the Economic Development Council have helped us mobilize to do what we can to help the business community. So if you don't mind, I'd like to just list a few things that we think the viewership might find important. First thing is that we have created a business assistance portal that's a comprehensive array of local, state, federal government agencies and nonprofit organizations that are helping employers and employees alike. So we invite you to look at youredc.com. Again, it's very helpful both for displaced workers and employers. Along with that, we have a hotline, and if you're a struggling business or you would like more information on the things that are available, again, from our governments and nonprofits, please feel free to call us at 772-336-6250. If you leave a message, one of our staff members will get back to you immediately. We also provide business disaster updates. Every day we send out to the business community important information that ranges all the way from the Families First Act to the CARES Act to small business assistance, disaster loans, and emergency bridge loans. Mr. Mayor, if I could expand on the point that you mentioned about the amount of distress that our local businesses are experiencing, since there's not really available data coming down from Tallahassee and Washington about the current circumstances of our businesses, whether they're experiencing revenue downturns, layoffs, halts in productions and orders. So along with some of the fine organizations that you just mentioned earlier, Chamber of Commerce, Career Source Research Coast, the Economic Development Council, and other organizations. We've partnered together to do a telephonic outreach to the business community and survey. So collectively, we touched 360 businesses, which is a fairly small representation of the businesses here, but there was some very distressing information that came out of that. These calls took place in the last 5 days. 26 of those 360 experienced significant layoffs. The combined total of those 26 companies that were in manufacturing, retail, service, hotels, 26 companies had layoffs totaling 1,019 jobs, which to me and to the EDC was quite distressing to hear in a very short, excuse me, in a very short period of time. Over 1,000 people lost their jobs in the last 3 days. That survey was completed in Monday, and we anticipate as we do another round of calls that situation will deteriorate even more. So there's certainly a need for all of us to work together and try to provide as much assistance we can to our employers and employees.
Well, we know that you're working hard and that you've recently proposed a very innovative and service-oriented virtual program. Do you want to share maybe the outline of that?
Yes, sir. Excuse me. I'd love to, Mayor. Going back to the fact that we're trying to enable local people to solve local problems, crashing websites, inability to touch real people on a virtual side to get information. We felt it was incumbent to work with our partners, in this case, the Florida Small Business Development Center at Indian River State College and the college itself to help companies. So our intention is to mobilize the Enterprise Hub at Indian River State College at the Pruitt campus in St. Lucie West. President of the college, Dr. Ed Massey, has agreed to take a facility and turn it into what you described as a virtual business recovery center. So the idea is to have individuals, professionals, volunteers that could be subject matter experts that could counsel and triage companies, whether it's trying to procure small business assistance loans, bridge loans, getting them help with HR personnel and some of the very important federal legislation that has come down, the CARES Act, Family First Act, et cetera. So we're looking to put that center up and running in the next couple of days. The Small Business Development Center, headed up by Tom Kindred, the regional director, has over 500 emergency loan applications to process on the state level. So they're inundated. So working together, we hope to provide assistance and counseling to local businesses.
And so as we as citizens and or business owners try to digest all this information that's coming in, can you explain the resources that might be available? So you mentioned some of these very, very important pieces of legislation. So I think one is the Families First Coronavirus Response Act. And do you have any breakdowns of what's in that or any links on your website that we could put the people onto, maybe what's most important about that act for the employees and the employers?
Yeah, so again, going to the Business Assistance Portal, youredc.com, there's a lot of factual, usable information on there. For example, we have from the U.S. Department of Labor, the Families First Corona Response Act Q&A, and it's a very clear, definitive document, which we encourage anybody to take a look at it. Additionally, if you do have a problem or you need additional information, we do want you to call 772-336-6250, and we will have one of our EDC members or professionals try to help you with a specific technical item with regard to that act, as well as the CARES Act, in terms of trying to secure the Paycheck Protection Program loan activity.
And that's hugely important. I'm glad you mentioned that. So, but going back to the Families First, is it fair to say that some of the key points of that act include the criteria by which people can claim family medical leave and basically sick time if they're an employee of a company that's up to 500 employees or something like that?
Mayor. Yes.
And so it's really important for the employer and the employee to understand each other's rights and what the qualifying criteria are. And then now you mentioned the CARES, and that was the big one that so many people waited for, because there's a direct benefit to a lot of citizens where you get the direct stimulus check, if you will. But then there's this other part about guaranteeing that jobs, that if the small businesses will keep them on the payroll, this loan will convert to a grant. Is that the big piece that you're talking about?
Yes, in terms of the CARE Act. So again, we'll try to help businesses as they come on a one-by-one basis, and try to get the answers that they need specific to their business and to the conditions of their employees. So that is available.
You mind if I ask you a nitty-gritty question here?
Of
You
course.
ready? Thank you, sir. What else would you say? Right? So,
I would think that there was something the matter with you, Mayor.
no, well, as citizens, we're just trying to decipher all the information. And, I don't like to play politics. This is a nonpartisan, just really care about pragmatic solutions, really. So a lot of us will hear, well, hey, this program is working perfectly, and then maybe you hear that the program could be better. So one of the things I think that we're hearing as citizens is that there's just so much demand. So can you just help us understand what you're trying to do locally to create as much opportunity so that people can make application to that program?
So, Mayor, I confess that, we're not subject matter experts on
Everything?
federal legislation. However, we have talented, hardworking professionals that will try to do what they can. Again, it goes back to the fact that this is a totally unusual circumstance and crisis, and there just seems to be a vacuum of credible, clear information and people that can explain it. So again, youredc.com, we're a local organization. Our mission is to help create jobs, help expand and bring in new business, try to do everything we can to improve the quality of the community. So again, we're trying to provide a local service and assistance platform to help companies and employers. One thing that's very important is all the distressing information and problems coming from being able to put in employment benefits. So you mentioned the Florida Department of Economic Opportunity, so they've had a lot of problems with people applying for benefits. So just wanted to make sure that our listeners, our viewers, know that there are now paper applications available, and I'd like to tell them that if you would like to get a paper application, you can get it at floridajobs.org /COVID-19, floridajobs.org. And for reemployment assistance and related employment services, our local Career Source Research Coast, has those applications and would be able to help the person drop off the completed paper application. That can be done at careersourcerc.com on their COVID-19 portal. So For those individuals that are having problems going online, DEO now has the paper application and would encourage folks to use those two websites to complete that.
Thank you, Pete. And just want to thank you for your continuing leadership. You work really hard in the community to create jobs, and that includes, a lot of times in economic development, we talk about new jobs, but retention is a big part of that always, and it's especially important right now. So Megan Roberts, Mick Roberts, one of our local reporters, is out there on Facebook Live, and she's asking if you have the number of businesses that have closed completely in PSL or St. Lucie County and maybe don't intend to reopen. Have you augured down to that level of detail yet to hear from people who have sadly not just shut their doors temporarily, but forever?
At this time, Mayor, as I mentioned about the survey that we've done, we are aware of businesses that have closed their doors. Again, because this is such a rapidly changing situation, what we know is that of the 26 businesses that have layoffs, they're currently not under operation, or they're on a very minimal scale. But we have not heard those that have completely closed. I think it's just a little too early to make that call.
No, and hopefully we can work to keep that number minimized. And going back to just commending you, I would say that just as the city and others, obviously Career Source, Research Coast, the St. Lucie EDC, everyone's breaking down those silos. So if people are trying to file for reemployment assistance, we're bird dogging that. Mr. Manager, you've assigned Elijah Wooten, our small business person, to really just get in the trenches and help people. And I feel like, Pete, you're doing the same thing with the payroll protection, the grant converting, the loan converting to a grant. I really feel like you understand that some of the larger banks are oversubscribed, they've met their maximum, and you're really trying to work with those service-oriented local and regional banks and credit unions. I know we have some good ones out there, Mid-Florida, Seacoast, we have a number. So I just encourage you and support you in every way to keep that up. You mentioned reemployment, of course, and Elijah's working on it, city's working on it, you're working on it, Career Source. I think the governor also announced a partnership with FedEx where you could take that paper application and actually FedEx it right to the state. They're going to cover that.
Yes.
And I think that's on your portal also.
Yes, just to be clear that FedEx or Career Source collects the applications on a daily basis, and then they're FedExed up to Tallahassee.
Thank you. Russ, do you have anything to add to Pete's comments?
Yeah, Mr. Mayor, you mentioned that our business navigator is available to help get people to the right location. He's available. We can call him. His number is 873-6374. Pete mentioned the Virtual Business Assistance Center. Certainly, I believe that that's going to be ramping up very soon. Elijah will be part of that team. And so, I think it's important that we're breaking down barriers. St. Lucie County, EDC, Career Source, Port St. Lucie will all be working together to try to get assistance to people. Our website is very robust for business assistance. It has links, has telephone numbers, in some cases people's names that you can contact. So I would certainly, if you're a small business, you have a number of different ways that you can get help. But you can start with the Port St. Lucie website, www.cityofpsl.com/COVID-19. That'll get you right to that website for business assistance. We may not provide the assistance, but we can get you there to get to the right place so you can access the assistance. One of the things that I've observed is there is a little frustration. It was just because it's moving so fast. It was just late last week that the Paycheck Protection information became available. certainly the CARES information is becoming available. Recognizing that if you're a business and you're closed, you don't have revenue flowing in, you don't have a lot of time to wait. But we're all trying to work to make sure you get to the right place, get information as fast as you can.
Thank you, sir. Well, if it's okay, we'll go ahead and go to questions, and we'll do our best to answer them. So one of the first questions we have from Diane is, will there be more testing in St. Lucie County, considering there have been 6 deaths? And what I would say, Diane, is that we will definitely have more testing, and we need testing. Testing is the key to the response. It's one of the 2 tools that we have in the toolbox. Remember that when we're dealing with a pandemic where there's no antivirals, there's no vaccine, really what you have is you have testing, isolating confirmed cases, and tracing of contacts, and you have social distancing. So there's really only two tools in the chest. Testing is one of them. And although we're ramping up testing, and you'll hear all kinds of statistics thrown out there, we're ramping up testing, we're doing this many tests, we're doing more tests. Unfortunately, we're not to the level where all symptomatic people can be tested. And as a result, due to a lack of test kits, there has to be tighter criteria on who gets tested. And so you're still seeing, and there are not many people out in the community that have contacted us and said, hey, we're symptomatic, but we can't get tested. So that's still going on. The criteria have been loosened, but not all the way to all symptomatic people can easily get a test. In our local experience, despite, let me be clear, that our leaders at the national and state level have been very supportive of testing. They're working on testing, but it's just ramping up when everyone's dealing with this, the supplies. Everyone needs the supplies, and they tend to go to the places with the greatest number of cases. So in the country, that would be places like New York, and in the state of Florida, that would be places like Miami-Dade and Broward. And so since there's limited resources, we have to advocate for them. And I sent a letter to the governor earlier this week, and that was one of the items in there, just understanding that he's working so hard, but asking for greater number of tests in St. Lucie County. I've personally been tracking kind of the testing effort across the state based on the Florida Department of Health dashboard. And in my analysis, I studied the 26 most populous counties, the 25 most populous counties in the state. As you may know, St. Lucie County is one of 67 counties. It's the 20 most populous county. And so I tracked the top 25 plus Martin. And based on the testing per capita, the number of tests carried out per person in the population, we're at 19 of 26. And then to your point, sadly on the deaths, the number of deaths of that same peer group, we're number 4. So in the state right now, as of 3:30 this afternoon, Palm Beach County had the greatest number of deaths per capita, followed by Clay County, Broward County, and then St. Lucie County. So that's not a position that I want to see us in, where we are lower on the per capita testing and we're higher on the mortality. So that's definitely something that we have to work on. And my opinion, on this is that we're working within this system where the whole world is facing this crisis at the exact same moment. The whole country is facing this crisis at the exact same moment. So we need the same things. And as you may have heard from the Vice President and others, emergency response is federally supported, state managed, and locally executed. And what that means for us here at the city level, it's not, so Mr. Blackburn is our incident commander, and he's working on our city response. But Mr. Manager, do you want to pick this up and just explain how really the county is leading our county-wide effort, and they're the ones that are executing it on the ground, and they kind of take direction and help and assistance from the state, and then the state, if they can't provide it, they go to the feds. Do you want to just share that?
Sure, yes. Thank you, Mr. Mayor. Yes, under state statute for our kind of county and municipality, The statute provides that the county is the incident commander, and they have the Emergency Operations Center. One of the functions of their Emergency Operations Center is the Department of Health. And the city certainly provides for the base services for the city of Port St. Lucie, but we don't provide health-related services. But we do participate on their calls. We hear what are the big issues, what kind of materials are in high demand, and the county actually asked the State Division of Emergency Management to coordinate large purchases and large distribution of supplies. And we know that testing, is really underserved. We've had, we need more testing in our community, in many communities. I did hear today that the state had allocated an additional 500 tests to the St. Lucie County Health Department. So they'll be distributing those tests I suspect, to the hospitals, in St. Lucie County, and that will help some. But it's, as the mayor, you're right on target. That's not going to be anybody who wants to be tested. There'll still be protocols, and the health department will generally be coordinating those with our local health institutions.
And just getting right to it, because if it was in our power to address this directly, I think we would. But our city manager, our commander-in-chief, our incident commander, he doesn't really have the ability to go on behalf of the city and go into this market under these circumstances and really be able to get test kits because the whole country is looking for them. Every hospital provider is looking for them. So we're really relying on the state. And really, that's why you hear the conversation about the governors going to the federal government and saying, well, we don't want to try to outbid each other, and we can't outbid the federal government. So we want to see those resources stream through that level. And here locally, Russ, I think and I can say we're looking for those Abbott test kits and the other type of test kits, because those are the ones that you hear people talking about, and our leaders talking about, and medical professionals talking about. This is the one that can give you results in 5 to 15 minutes, depending on if it's a positive or a negative. And we have that testing equipment in our market. It's just that those test kits are in such demand, we don't have enough here to do as many tests as really needs to be done pursuant to the epidemiological standard. And I can just speak to you from personal experience that it took 14 days to get my results. And we have someone in the office right now that's out, and that person is waiting for his or her results. And I believe that he or she is on day 9. So even though we know this is an issue, and even though our leadership at all levels is very supportive, we're just not where we want to be yet. So we're going to have to keep working on it. And unfortunately, it's not something where the council and I can say, hey, Russ, go solve this problem. We just have to advocate. And that's what we're doing, and that's what I'm doing on your behalf. And with the council's full support is advocating on these key issues and just making sure that we're not lost. I can tell you that as mayor, one of the things I worry about is if you equate this to a hurricane. Well, when you have a hurricane, it hits one city, one region. Even if you have a worst case scenario on the track, it impacts a lot of cities. We've had that happen, go right up the tailpipe of Florida and impact a lot of people. Even with that scenario, all the other states are always there to have our back. All the other power companies are there to have FPL's back. In this case, the whole state, the whole country, and essentially the whole world is experiencing the disaster, the emergency at the exact same time, and that really makes it more difficult. And because we only have 325,000 people compared to the millions in Miami-Dade, or the couple million in Broward, and the 1.7 or so million in Palm Beach County, you worry about your community of 325,000 and not getting lost, because on a per capita basis, we could be facing, very significant impacts. So that's that issue. Of the 130 cases in the county, how many are in the city of PSL? Most are in the city of PSL. So if you go to the Florida Department of Health webpage, you'll actually find a report that's updated every day. It includes the address of everyone who has been confirmed to have COVID-19. It also sadly lists and chronicles every death, and they'll identify the mailing city, if you will. So because the city of PSL is a majority of St. Lucie County, we're 60% plus of the population, our expectation would be that you're going to continue to see that play out.
And Mr. Mayor, I believe that that data for this morning was 99 out of the 130 were PSL zip codes. So they may not all be living in Port St. Lucie, but then they're in a zip code that's considered a Port St. Lucie zip code.
Thank you. And, you know, for me, we function as one community. And in fact, as far as metropolitan statistical areas go, or larger markets that function as one greater community for the purposes of commerce and living, Martin County is in our MSA. So I think about us all, and that we're all grappling with that. I mean, just to put it into context, at this point, I think we've lost roughly 14,600 Americans to COVID-19, 323 people in Florida, and 6 right here in St. Lucie County. So let's see. This one's for you, Mr. Manager. What is the reasoning behind closing the boat ramps completely? What is the downside to opening them Monday through Thursday and closing them Friday through Sunday?
So this is a great question. It's one of those we struggle with, and we made the decision based on believing that we had a calling to ensure that all of the community was protected. So there are many people who use our boat ramps. It's a family unit. It may be a couple people going out fishing, and those individuals can meet the CDC guidelines. You know, they can be separated. They're not large groups. But we saw far too many boats with 9, 10, sometimes even more people on some of the larger boats appearing to be going, you know, out for party rides. There was a belief that we couldn't control that as a city, but we were actually facilitating that behavior. And that by facilitating it, we were potentially putting all of our city at risk. There's certainly, and I'm absolutely sure there are individuals who say, but it's just me, I'm just going out fishing. I'm just going for a boat ride to get out of the house, and that's very safe. It's when the larger groups are on the boat, they start tying up together, and all of a sudden you went from 2 to 12 or more. And that's been our concern, that we didn't want to facilitate as a city that gathering that becomes larger than the 9 that the CDC recommends.
Thank you, sir. So in this case, again, you are the commander-in-chief. I'm only one of 5 votes. If there's ever the day that you believe you could operate the boat ramp safely and compliant with social distancing, then I would support that. But I respect your judgment, and I know that you're working to keep our community and our employees safe. So thank you for that. Has the bowling alley closed not to reopen due to the virus? So I know that Super Play had been closed due to the virus, and St. Lucie Lanes is actually outside of the city of Port St. Lucie. So I haven't spoken to them directly. Mr. Manager, I don't know if you want to address this. Certainly under the slow the spread of coronavirus guidelines, it specifically states that in states with evidence of community transmission, bars, restaurants, food courts, gyms, and other indoor venues where groups of people congregate should be closed. Do you have anything additional?
I don't know specifically about the bowling alley. I think I do not believe that would be an essential business from my recollection. Certainly, if you own a business, you should always check that list from Miami-Dade County. There's a very long list of essential businesses. And we may see some businesses that don't reopen, but the Paycheck Protection Act will allow businesses to bridge through. We also have other loans through the SBA that Mr. Tesch was mentioning earlier. So we hope that our businesses all will look online. Will take advantage of the virtual business assistance center that's opening up to make sure that they get through the roughest times and can start seeing the time when we do see some of the social distancing relaxing a little bit. So we don't know specifically, but we do know that if they are closed right now, they're following the governor's order.
Thank you. And I don't see bowling alleys being able to open. I don't think they're specifically listed as an essential service. I think they are an indoor venue, just similar to restaurants and all those other entertainment uses, movie theaters. And it's just, that's a place that's really designed to be a place of a social gathering. So it's just not, I think, conducive to where we're at. It doesn't promote social distancing. It's kind of antithetical. And if you think about bowling, the activity, you're gathered together around a ball return, you're touching a ball, you're touching common areas all the time, and it's just, it doesn't lend itself to social distancing and these requirements. And so here we're having this conversation again about essential businesses. We could also talk about essential activities and whether or not you're covered by the governor's order as being essential. And let's just also take this moment to wish everyone who's celebrating Passover, happy Passover. I think that starts this evening. And of course, we have Easter this weekend. And the governor made it very clear that worshiping, even in a sanctuary, is an essential activity and something to be protected and honored. And we certainly understand that and agree with it. And I think everyone up here goes to church, if that's fair to say. But at the same time, whether you're an essential activity or essential service, we are asking and we are urging you to follow every precaution you can. So that means everything under the slow the spread guidelines, and I'm sure you can recite those in your sleep by now. But you know, that's if you're sick, you stay home. If your kids are sick, keep them home. If you've tested positive, keep the entire household at home. If you're an older person or immunocompromised, please stay home. Avoid social gatherings, avoid discretionary travel, wash your hands. And of course, if you sneeze or cough into your elbow or into a tissue and immediately throw it away. But in addition to those, we're also calling on our essential services, our businesses, and everyone engaged in essential activities to please follow the social distancing requirements. And remember good rules of thumb like 6 foot separation between people. Please remember, if you're a business owner in an enclosed space, 25% of the occupancy. Those are good rules. That's a good rule for Home Depot. It's a good rule for Publix. That's a good rule if you're going to have a church service in sanctuary inside the church. It'd be great if you did the drive-in movie theater concept for church or the broadcast. But if you're going to do it in the enclosed space, please follow the 6 foot rule. Please keep occupancy down. And in addition to that, please do screening where you screen your employees and your guests to make sure that no one's sick. And then please follow the cleaning protocols. And these are very specific. They're available at cityofpsl.com/COVID-19. And they're also available on my Facebook page. But it would be great if everyone can follow those, because the virus doesn't care if we're 250 people gathered together for the higher purpose of worshiping God on our holiest of days, or if we're 250 people together inside of a movie theater watching a movie for social purposes. The virus just sees it as an opportunity to spread and to make people sick, and we've already seen that play out in New Rochelle, around a synagogue. We've seen it happen at a revival in Kentucky. We've seen it happen with the Presbyterian choral group in Washington. So let's learn from that and not repeat the same thing here in Port St. Lucie. Don't want Passover and Easter Sunday to be a day that the virus spreads in Port St. Lucie or anywhere in our country. Russ?
Mayor, I noted earlier that we have a very robust website under the City of Port St. Lucie. And on that website, under the COVID-19 section, we do provide some guidance to businesses, how they can comply with the CDC guidelines. We've got some examples, some sketches, how you can lay out your registers, how you could show how your circulation occurs up and down rows. We are going to be providing, tomorrow we'll be updating with businesses that are following the 25% guidelines, so that we're surveying this afternoon and tomorrow, and we'll have information on those that are restricting to 25% occupancy in the building. So you'll be able to find that all on the City of PSL website. A lot of information on businesses that are open for takeout, for delivery to the curb. Those are the businesses that we hope everybody in our community frequents. You know, let's reward those businesses. Let's say, hey, we're glad to go pick up takeout and eat tonight, because those folks, they need the revenue and they need to keep their employees employed.
They do. It's a great point, Russ. Thank you. So this is a speculative question from Mary. Do you see that in the very near future you would allow many businesses to reopen and isolate those who are vulnerable, such as elderly and those with health issues that make them susceptible, limit occupancy for restaurants and theaters possibly? So again, we're not necessarily driving this conversation at the local level or even the county level. It's really being driven by the governors, and then also the federal policy and what the president is asking through FEMA and the CDC. So I think it's fair that we could speculate. So again, this is just opinion based on my read of the situation. We're gonna continue through this response effort, right, where we're really focused on saving as many lives as possible and minimizing the loss of life. And we're gonna flatten the curve. And then you're gonna see the president and the governors and all across the country, they're going to start floating proposals about how we can return to a new normal. And I do believe that unless there is just a miracle where a vaccine becomes available or antivirals become available, I personally think that you're going to see this move towards masks accelerate. I think that eventually the N95 supply, the PPE, will catch up, and that will be made available to more people, and that you'll see guidance that should be used. I do believe that the elderly and immunocompromised will probably be asked to stay protected so that they're not unnecessarily exposed. You're going to have to see testing ramp up in a real way and almost be instantaneous, but there can't be this barrier to fast, reliable testing. And I think you're going to see the antibody test come into play, so that once you have people cleared and they can no longer be sick, they can no longer make you sick, they're going to be able to cycle out there first. Mr. Manager, do you want to just provide any of your professional thoughts?
Mayor, I think it is speculation. I do believe what Mary has described will be exactly what will happen. I think it's a question of when. So it'll be after we've seen that spike of COVID-19 cases really begin to go away. And then I think you'll see those folks most at risk encouraged to continue to totally follow the CDC guidelines. But it's, say when that will occur, I think is anybody's guess. But we're hearing anecdotally that they're already seeing in New York, fewer numbers of people testing positive. Florida's going to be a month or so behind that trend line. But, as we begin to see that the social distancing is making a difference, and is really greatly reducing the number of people who are testing positive, I think you'll begin to see businesses reopen. It's just it's hard to predict exactly when.
Thank you, sir. Pete, do you want to offer any speculation or your thoughts on it?
Well, I believe, just to reinforce what the city manager said, Mayor, the safety and health of our citizens is the most important thing. And if there can be guidelines put into place that will allow that into businesses. Again, it'll probably have to be focused on specific ones. But I would hope that that would come, as the city manager said, when, and it can't come soon enough.
Thank you. But that is the push and pull. And I think that a lot of the public health officials worry, and one of the things I worry about, and you could actually study this there's a great National Geographic article about the 1918 flu out there, the 1918 flu pandemic. If you think about us, kind of being like a turtle and pulling everything in, you don't want to poke your head out too soon. And so you don't want to declare victory just because the curve is flattened, everyone goes about their business, and then all of a sudden you have a second wave that actually built off a higher floor, right? So that's what's happened before with other pandemics, and I think a lot of people are worried about that. So that right time is, I think, the key, and we're having to rely on experts above us. You're not personally making that call, Mr. Blackburn, are you?
Definitely not, Mr. Mayor.
So is hydroxychloroquine available to PSL citizens, Mr. Manager?
Mr. Mayor, there's been a lot of talk about this as a potential treatment together with the Z-Pack at the national level. I did hear that there was some doses available in the state of Florida, but we can't comment on exactly what treatment is being provided in the hospitals or when a particular medication is being available. We don't control that and don't know the answer to that question.
Thank you, Mr. Manager. Just for anyone out there that's concerned about the availability of resources to our residents, what I would say is that they're building the strategic Federal Reserve of the medicine and the dosages, and that states can make requests, and I believe our governor has done that. And then the local EOCs, Emergency Operations Centers at the county level, put in the requests to make sure that there's adequate resources available to the residents of a county. And I think everyone is doing their part to make sure that our citizens are given every opportunity to be well. Thank you, Sarah. Russ and our team and people like Pete are working as hard as they can. Our first responders are working as hard as they can. The entire city staff, I'm sure you're very proud of them, Mr. Blackburn.
Sure.
And certainly the council and I are very proud of you and our team and our partners like Pete and Jill and Jen. Can we ask citizens to decorate their homes in blue to support healthcare workers? Absolutely. So this is a great opportunity to thank TAMCO out there in Southern Grove, aka Tradition South, aka the Jobs Corridor, right at 95, just south of the hospital. If you've driven by at night, you know that they have lit it up blue. And so their building is blue in honor and recognition of all the healthcare heroes, the first responders, and the essential frontline workers. And then also the council and I and others have been calling on residents to put blue ribbons on their front porches, trees, mailboxes, and other areas of your front yard so that people can see it as they drive by and know that we're supporting those important groups. So Megan McRoberts, with residents being encouraged to call 911 if they see large groups in places like parks, is the city getting more 911 calls? And does it seem like it's making a difference, Mr. Manager?
Yes, Mr. Mayor, we're doing and taking the actions that we can to eliminate gatherings larger than 9 people. We have restricted our parks, our playgrounds, to ensure that people can walk, they can run, they can have a picnic with a family unit. But we want those parks to be available for all of our citizens. We did indicate last week, because we were getting a number of reports on social media about people, in some cases, congregating in larger groups. By the time we received that notification, dispatched a police officer to go and disperse the group. the group had already left. Sometimes it was the next day. So we have asked that people call 911 so that we get a quicker response. Truthfully, we have not had that many calls on gatherings larger than 9. I think it is the fastest way to get, an officer out to go and educate people about the CDC guidelines and to help them have them disperse. It hasn't been an overly large burden at this point because we're getting more and more compliance through education, which we really definitely appreciate.
Thank you, sir. There's a question about the timeline on opening beaches, and here in the city of PSL, we don't actually touch the ocean, so we don't have any manned beaches. We'd refer you to St. Lucie County for that. They have a landing page on COVID-19 also, and it has an update of all the facilities that are open in St. Lucie County. So if you would just Google St. Lucie County COVID-19, you would find their landing page at St. Lucie County. And they're also doing press conferences and other things to keep everyone updated. And I would just encourage you to stay tuned to their webpage. So again, we have another testing question from Deborah. And Deborah, if you didn't hear the previous conversation, relatively speaking, compared to other similar counties in Florida, we do have a low per capita testing rate. It is something that we have to work on. And we're going to continue to advocate to make sure that St. Lucie County's residents have access to the testing that they need and deserve. At the same time, we have to understand that there's international, national, and state demand, and there just aren't enough available test kits yet at this point. This is an opportunity to mention that earlier this week, the Department of Health put out a survey, and I don't know if you've seen this yet, but I would encourage you to take the survey. It seems like they're finding different ways to surveil the communities and identify areas for additional study. And the health department officials want Floridians to take an online coronavirus survey, and it's part of a Stronger Than COVID-19 campaign. And the survey can be found at www.strongerthanc19.com. So strongerthanc19.com. And it's an anonymous survey, but it asks you a number of questions that really correlate to those testing criteria. So it seems to me that they're looking for potential hotspots or areas where there's a higher prevalence or possibility that there could be an elevated number of COVID-19 cases. So again, that's strongerthanc19.com. We encourage you to take that survey. I'd also encourage you to heed the call. If you're in the medical profession, Medical Reserve Corps is looking for people to step up and be available if the need arises to volunteer. And as anyone who served in the military knows, that call has also gone out to retired military personnel who want to heed the call to go back in service in the fight against COVID-19. So also take this opportunity to promote that. All right, we're just going to take a couple more questions. And you've not heard any discussion, this is from Mark, not heard any discussion of the wearing of masks when in a social situation with other people. Are masks a deterrent from spreading the virus? So none of us are doctors, but we try to stay up on the CDC guidance. And Mr. Manager, do you want to just give your 2 cents on that?
Mr. Mayor, the U.S. Surgeon General did recommend that it would be a good idea for folks to wear a mask. It's not required, but there is anecdotal information about what's happened in other countries, particularly where they've seen a reduction and slowing of the curve, where more and more people were wearing masks. And there was another question that was kind of similar about what kind of mask should you wear. And certainly the question of when you're going to be near folks, and you'll see in our hospitals, you'll see they're wearing an N95 mask. very tightly fitting to try to keep the any kind of virus out. Other masks are good just because they keep us from touching our face. They keep us from, if we happen to sneeze, they keep the droplets that when we sneeze, to keep them from going, in a room in a larger area. So the wearing of masks isn't mandatory, but it's been suggested by the Surgeon General and others that it really is something worthy of considering.
Thank you, sir. And just some key points there. I think the research on N95 masks say that they keep out 95% of particulate matter if they're fitted properly. And when it comes to the other type of mask, and remember right now there's a shortage of N95 masks, so we really need the healthcare heroes to get those. And then I think first responders is the next category. And so hopefully we're just going to keep on ramping up that supply. For us, it's really about cloth masks, and there's some really nifty designs out there. This was made for me by a caring neighbor, Vicky. She's amazing, and she actually wove a filter in here. But I think if you read up on masks online, you're going to find that you want to use a material that's dense and also breathable, right? So you want to find that balance. But if you hold it up to the sunlight, you don't want to be able to see sunlight through it, right? Because that means a lot of material, a lot of particulate matter, potentially viruses can get through. So the tighter the mesh, the better. That's what you want your mask to be made out of. But the healthcare professionals are really worried that we'll think that this is protecting us and that we won't engage in social distancing. And remember that social distancing is our #1 weapon, and what they're telling us now is that this is really for those who may be sick, who may be asymptomatic, especially with this disease. This mask is to keep me from sneezing all over you, really. It's not to protect me from the virus, it's to keep me from getting Pete really sick. And so here we are in this big room, we're in the council chambers where, over 100 people will fit, and it's the three of us and Avi. And so there's not a lot of loading in this room right now. We probably all feel pretty good. But I'll tell you that yesterday when Mr. Blackburn and I met in his conference room, we were 6 feet away from each other, but we both had our masks on. Right. Because you just feel like in that smaller room, you're getting a lot of loading from exhaling into the room. And so as you talk in an hour-long meeting, it's getting filled with vapor, which could potentially be home to the virus floating around. The last thing I want to do is make our commander-in-chief sick from COVID-19. So in that case, it took the precaution. But this is to protect others from us. This mask doesn't necessarily protect us from the virus, and that's where we're at. I think you're going to see that change as supplies become more robust. But again, right now, if you have N95 masks, please give those to healthcare heroes or first responders at this point, and just keep practicing social distancing. And there again, do you think it's fair to say that you wouldn't unilaterally impose that, Mr. Manager, that would probably come in concert with the discussion with the county at a minimum?
The county, and I believe the state as well, because we cross jurisdictional lines. It's a kind of order, if that were to occur, it really would start at the governor's office, I suspect, and then enabling counties and cities to make that decision.
Well, and I think to Lucinda's point that it may be, and I got to check the order, but it may be that the mayor of Miami-Dade provided the order to wear masks. But just as a point of clarification, again, you watch something on TV and it's not necessarily the same thing here. So there's a county-wide mayor in Miami-Dade County, and that's not the city, that's the whole county. And so that's the equivalent of the county administrator here. So just as Russ is our commander-in-chief at the city level, the county's commander-in-chief is Howard Tipton. And we call him the incident commander.
That's correct.
Any closing thoughts? Thank you again, Pete, for you and the EDC's hard work and all your investors. We appreciate you.
Thank you for having me tonight, Mayor.
Yeah, and thank you, and give our best to Jill and Jen and those hardworking 6 employees that you have over there. I guess 5 others?
Yes,
you plus 5, And Mr. Blackburn?
Yeah, Mr. Mayor, I just want to remind folks who are checking in on Facebook, of the resources that are available for the city of Port St. Lucie. So we have a tool called 1PSL. That's our call line for COVID issues or other issues. The phone number is 871-1775. And certainly we have a ton of resources available, links to the state, links to federal information on our City of PSL website, www.cityofpsl.com/COVID-19. We'll look on our website. There's a banner right across the top of the website. It'll get you right there.
Thank you, Russ. Thank you to you and our hardworking, award-winning team. Thank you for working so hard for our community. This is when we have to be at our best. And I know that you and the team are just working day and night. And it's important that we share information and provide the best information available. So, we don't have the same type of numbers as New York. We're much smaller. We're 325,000. But relatively speaking, we are experiencing a high mortality rate. We have seen the number of confirmed cases in St. Lucie County, the number of people with COVID-19 triple in the last week. So some of the models are saying that we'll peak over the next 2 weeks. That remains to be seen. But we know from other municipalities, other cities, other states, other countries, that social distancing works, and that we can flatten the curve, and we can protect our community, and we can reduce hospitalizations, and we can save lives. And just want to express our thanks and appreciation to the people of Port St. Lucie who are doing that. And if we keep doing that, if we don't poke our heads out too soon, if we just follow through and keep working with our county, state, and nation, our entire country, if we keep working hard, smart, and together, we will get through this response. We will recover, and we will prosper. And as we stay focused on this response, at the same time, we have to be looking at the recovery. And if there's anyone out there that wants just a glimmer of hope or wants to feel good about the future, in addition to closing by giving you the very best wishes at Passover and Easter, earlier this evening, thanks to the hard work of these gentlemen, our team, our city council, and just a number of people in the community, we went forward with a purchase and sale agreement with the Excel Group, who is a high-tech wire manufacturer. They make wire for spaceships and airplanes, and they're proposing to relocate from Connecticut.
Yes, sir.
And they're proposing to build at least one factory with hopefully more, where they're going to put 125 people to work, making well over the current average wage. And so we're working right through this emergency on our bright future. So if we could just do what we have to do to get through this emergency, the future is still bright. But first things first, let's remember what's at stake and keep doing everything we can to protect our community and save lives. And we appreciate you being informed and tuning in with us tonight. Thank you, PSL. Thank you, Russ. Thank you, Pete. Good night.